Thanks for staying tuned into the channel. Today on our YouTube channel, we are going to be talking about Prominence Health Plan Medicare Advantage members and their access to St. Mary's. Now, my name is Matt Law with Health Benefits Associates. We have offices here in Reno, Sparks, and in Carson City, and we're here to help you understand your Medicare options, enroll in Medicare plans, and like today, understand network list changes on different plans. Now, today's topic, as we mentioned, is Prominence Health Plan, which is a local Medicare Advantage insurance company in Northern Nevada, and their status with St. Mary's Medical Group and St. Mary's Urgent Care. And this is an update video from what we brought to you about a month ago. So we have a new update, and we're going to take a deep dive into how it affects you. Now, before we talk about how it affects you, let's talk a little history. First off, I don't know if you knew this, but Prominence Health Plan used to be known as St. Mary's Health Plans. And that was right around 2016 when St. Mary's Health Plan was operated by St. Mary's Hospital in Reno and then was purchased and sold to Universal Health Services, which owns Northern Nevada Medical Center. Which, if you are a Reno or Sparks local, you definitely know about Northern Nevada Medical Center because it's the hospital on the hill in Sparks. Now let's talk about 2021, which this year has been wild in healthcare. I think you guys have seen a lot of videos from myself and from Alex Sampson in my office talking about all the different hospitals and the changing contracts with different insurance companies. And believe it or not, we've actually made videos on every different hospital in Northern Nevada. So Renown and their contract disputes, Carson Tahoe, and now St. Mary's. It just has been a wild year. So I don't know if this will be the last video of the year where we have some sort of contract dispute, but today we will be focusing on St. Mary's and their medical groups with Prominence Health Plan. Now, looking into the future, in 2022, there is a new hospital coming to town on the south end of town on Longley and Double R. It is the new Northern Nevada Medical Center, the Sierra facility, and it's got some great capabilities. We've actually toured it. Our whole office has toured it. And we're going to talk a little bit more about the future of healthcare at that facility later on. But just know that we have healthcare options coming up in the future. But let's talk a little bit more about the past. Specifically August 7th, 2021 of this year, where we actually had our initial update with Prominence Health Plan and the hospital at St. Mary's. Basically what happened on August 7th is St. Mary's Hospital cut itself off from Prominence Health Plan HMO plans. So this includes Medicare Advantage plans. And as of August 7th, the hospital and its services in the hospital were out of network for Medicare Advantage members. Prominence is working really hard and diligently with its members to make sure that they can continue care at the hospital. And this is done through many different ways, but one of the main ways, and the first point you'll see over here, is letters of agreement. Letters of agreement allow you, a member, to continue care based on your situation at out-of-network facilities while still being covered under in-network benefits. Gets a little bit complicated, but those are things that brokers like us at Health Benefits Associates can help you understand and navigate. Now, today is September 24th, and right now, with the August 7th release of news with St. Mary's Hospital, the medical groups are still covered. So you can actually, as of today, still go into a St. Mary's medical group, see your primary care physician or specialist in network on your Medicare Advantage plan through Prominence. Also, you're able to see urgent care or go to urgent care facilities and go into the emergency room in network on your Medicare Advantage plan through Prominence. But this is where it changes. And this is where, looking into the future, on October 13th of this year, 2021, the medical groups at St. Mary's have cut themselves off completely from Prominence. I don't know if it's quite a shock. We'll talk about that in a second. But basically, these medical groups, if you have primary care physicians or specialists at St. Mary's, and you have a Prominence Medicare Advantage card in your wallet, after October 13th, you will not be able to go see them. You will also not be able to go to the St. Mary's Urgent Cares in-network on your Prominence Medicare Advantage plan. However, emergencies are still covered. On Medicare Advantage plans, if you are in an emergency situation, those are covered in-network at all facilities. So, let's talk about today's next steps. And Prominence has been working very hard for the past month to mitigate a lot of these disruptions in your network list. So first off, if you have a Medicare Advantage plan through Prominence and you see St. Mary's doctors, expect to get a letter in the mailbox from Prominence discussing what is going on and what you can do to get established with new doctors. And if you have St. Mary's doctors today and you're actively in treatments, Prominence will actually be calling you to reschedule your appointments with the many doctors they have still in network on your plan. Now, the other thing too, we talked about letters of agreement earlier, and that is still an option on the table for people who are going through surgeries or extensive treatments, and Prominence is looking at those by a case-by-case situation to see if they want to extend that and if they're able to get a contract with St. Mary's. But it's been hard for Prominence to work with St. Mary's right now, and we're hoping that they can both come to an agreement so you, the patient, can be taken care of. So one of the things that, as a broker, I'm really looking into these plans, and I want to make sure you and all of my clients watching are taken care of correctly. One of the big things that is a concern to me, and actually I'm not very concerned anymore, is the urgent care situation with St. Mary's. Most of my clients have been accustomed to going to St. Mary's Urgent Cares on their Prominence plan. Good news is that Prominence has a few tricks up their sleeves, and they have new facilities around Northern Nevada to take care of you. So there's a lot up here on the screen. We're going to have a link to this in the description of this video, but just know that you're going to be able to go to Carson Tahoe Urgent Cares in the Carson area. There are Concentra Urgent Cares in the Reno area. There's the new Northern Nevada Medical Group Urgent Cares in Sparks, and there will actually be more of those being open throughout the next few years. But something I'm actually really excited to talk about is Dispatch Health, which is actually at-home healthcare. And you can see from this list of services that they actually come out to you and not only see you, but they treat you on the spot. And I think this is the way of the future for healthcare, is you're actually still going to be walking into brick and mortar facilities, but at-home care and virtual healthcare will be increasing dramatically as the years go on. So Prominence has contracted with Dispatch Health to get you urgent care services in your home, which is really convenient. You don't even have to wait in line or potentially get sick at the urgent care, traditionally what we've always been accustomed to. Now, there's also another service that Prominence contracts with, which is geriatric specialty care, very similar to Dispatch Health, where they will actually come out to your home and they will help manage your care and just take care of it on the spot without you leaving your front door. So just know, if you're concerned about urgent cares like I was earlier today, once you do research, it actually looks like Prominence has come up with a very good solution for the time being, and they are going to be building off of their new Northern Nevada Medical Group Urgent Care and building more throughout the area. So we're expecting to see more urgent care access as the years go on. But some of you also might be concerned about specialists, which once again was another concern of mine. But cardiology and pulmonologists are being handled correctly with the transition of this contract. And this is where Northern Nevada Medical Group and Northern Nevada Medical Center are giving priority access to people affected by the St. Mary's contract. Priority access means that you actually get to get in quicker than the general public at these specialists. And Prominence is really working hard with their hospital, Northern Nevada Medical Center, to get you in as quickly as possible to meet a new doctor and get established and get treated efficiently and effectively. Now, a few of these doctors we've actually interviewed on our Hello Health series. Dr. Wadi Gonzalez is a cardiologist. Dr. Letitia Anderson is also a cardiologist. And Carrie Yamamoto is a pulmonologist. So if you want to learn more about these doctors and actually meet them virtually through our YouTube channel, We actually have a bunch of videos through our Hello Health series, which you can watch by clicking on our channel and looking into those videos. So where do we go next? And this is where, when we're talking about our specialists, we want to make sure that if they're not the right fit for you, that you find the right options for care in the future. Here at Health Benefits Associates, we're here to teach you about healthcare, but also help you find the right Medicare plans. Annual enrollment period starts on October 15th and ends on December 7th. So if you want to chat about this or find a Medicare plan that still covers St. Mary's, or maybe get connected with a new doctor if you have a current Prominence plan, give us a call. We have offices in Reno, Sparks, and in Carson City. One of our many Medicare advisors would be happy to help. There's also the care coordinators at Prominence Health Plan who will be reaching out to some people proactively, but you can always give them a call if you have questions or concerns. They will help you schedule appointments and find the right doctors for you. Lastly, I want to finish it off by looking into our crystal ball at the future of healthcare in Northern Nevada. I talked about the new hospital. I'm really excited for the new hospital, the new Northern Nevada Medical Center. And one of the things that we looked at was the TAVR heart procedure room. And so if you're someone who sees a cardiologist, you probably know of the TAVR heart procedure. But Northern Nevada Medical Center is really ramping up cardiology capabilities, and they will be the facility of the future in the area for anyone that needs cardiology treatments. So just keep in mind that if you're really concerned about your St. Mary's doctors today, we'll help you get a resolution today, but a few years from now, many of the people in Northern Nevada may be looking at Northern Nevada Medical Center's home base for healthcare, which I think I don't know if I mentioned this, but Northern Nevada Medical Center's parent company, Universal Health Services, owns Prominence Health Plan. So if you have a Prominence Health Plan, you'll never have to worry about losing the new hospital or the hospital on the hill in Sparks on your network list. Now, I think I've gone through a lot today. You guys probably have a lot of questions. You can stop watching the video, give us a call, and we'll be happy to help. My name is Matt Law with Health Benefits Associates, and we'll see you next time.